What came out of that group was the desire to see some sort of universal health care implemented, and that universal health care be tied to people participating in preventative education. So the idea was that if someone were to get a regular checkup or participate in the preventative care, then they would be eligible to participate then in universal health care as an idea. Same thing from an employer position. So employers might have their employees who then took these preventative methods. They would provide discounts on health care for those who were to participate in the preventative ideas. And that's what came out of that one group. I thought that was a good idea, and that's what we'll come up with from a recommendation standpoint. So I'd like to invite the scribe for the group here to come up and share what you learned.
Our group, we came up with the idea of the lack of information, education, and resources for low-income individuals and families. Pretty much, it goes back to the same thing the gentleman was saying. You know, if people are educated about what is going on and they have the resources for them to live a healthier life, they more than likely will lead a better life, making the doctor the last resource and not the first resource. And that will cut down on a lot there.
Actually, we had a wonderful time. Our group talked about so many things. We had 3 nurses in our group. So we were able to come up with various healthcare stories, and we concluded that it's very important, extremely important, for us to have healthcare reform. I.e., for instance, 2 of us were utilization review nurses, and our job was to go into the hospitals and discharge the clients, discharge the patients, and give them as minimal care as possible. So we talked about that. We also talked about what was the major thing that was concerning healthcare, and we came up with prevention. On a consensus, we talked about prevention. It's very important that we focus in on our health, what we eat, how much water we drink, look at the medications we take, the side effects, and all of that is a part of prevention. And if you have prevention, you will have better health, and you won't go into this high cost of health care. And I think that's it in a nutshell, and we really enjoyed this, and we want to thank you so much for putting this forum on for us. Thank you.
Our primary thrust was that we were talking about national health insurance, and we think that that's a good, viable thing for everyone, that if you had a national health care plan that covered people from state A to state Z, you wouldn't have the high costs. Our number 2 thing was that, as one of our members of the group brought up, is that there is no concerted effort to take care of people with special needs in our health plan. Because even though you do have insurance, a lot of your insurances are HMO, and they do not cover out-of-network specialists. And most specialists are cash only. And we think that that needs to be addressed. We also said, just like one of the other persons that was up here speaking, that you need to have a prevention type program. We don't have it on a widespread basis. Even now, we don't have nutritional education, and that's very important. I'm a sufferer of diabetes, and that's one of the reasons that I got it was my nutrition, not so much my exposure, but proper nutrition doesn't mean French fries, doesn't mean steak all the time, and those are 2 things I really love, and I had to learn how to give up. But all in all, I think that we had a great time, and once again, our thrust was that national health insurance for everyone at a reasonable rate. Also, another idea that was brought up that I forgot to mention was the concentration of treatment of a neurologist, recognizing neurologists as medical people. All right, thank you.
Taking into account everything that was said, we were very big picture. What we looked at and said, we have a big picture goal. We're going to take money and all that other stuff out of the equation and say our goal is for every person in the U.S. to be a healthy citizen. That is the goal. It is the same goal or similar when Kennedy made a statement back in his time saying, let's go to the moon. It was the desire, there was not the math, there was no technology to provide, but the mission was made, it was accomplished. The goal here is say, let's make every citizen in the U.S. healthy. We didn't we talked a lot, but really, it's not about should healthcare pay for it, should a health plan pay for it, should insurance pay for it, should people be profitable. That's not the goal. Those are other things. Should a corporation be profitable or not? The mechanics. The mechanics only deal with the goal. If the overarching goal is for, out of this planet of 6 billion, 307 million people in the 48 connected states, and Hawaii and Puerto Rico, to be healthy, that's it. It means it is a commitment from the top down asking of the citizens to do just that and to support just that. And don't let technology or the lack of technology or a corporation or the lack of a corporation get in the way of solving that goal, because time and time again, this country, as young as it is, has solved these type of problems. When we needed machines in the wars, they came from zero to world class. When we needed to go to the moon or whatever else, this country has, and its citizens have shown many times, if a commitment is made that everybody buys into it, the goal will be achieved. So our goal that our group came up with is, we have a desire for the president to say to the citizens, we want a healthy country. By this point, from this to 90 or whatever, you're healthy, because we're going to put everything that's necessary to make that happen. That's our goal. Thank you.
The first one is about mammograms, and I'm stating right now that mammograms cause 4 cancers for every one that they detect. They're 70% inaccurate. They use them because it's a big money maker. If you want to detect cancer, there's a blood test called the AMSA blood test that'll detect cancer 2 to 3 years before a tumor will even develop. And you can take preventative measures at that point. There's a urine test that was developed in this country in 1930. The only way you can take that test is by processing the urine yourself, mailing it to the Philippines, and waiting about 4 weeks for the result. That test is over 90% accurate. Not only will it tell you how bad you are, if you take it before you undergo treatment and take that test every 2 weeks, it'll show the progress that you're making. Doctors deny that that exists. What's wrong with this country is they have not validated herbal medicine or naturopathic medicine or homeopathic medicine. In most states, naturopathic medicine is not allowed. Herbalism is not allowed. There's other recommendations here about cholesterol. You should never get tested for cholesterol because it's not a disease. They have medications that lower it, but what good does it do? It causes heart attack or stroke. The lower you bring your cholesterol, the more prone you will be to have a heart attack or stroke, and you're shortening your lifespan by 5 years. Who tells you this? Doctors, scientists, okay? AMA, they denied that nutrition has anything to do with health ever since they started in 1850. Only last year did they recognize that you can reverse type 2 diabetes